Hi friends, I'm sure you have heard the term insomnia or lack of sleep. This may be of different types like difficulty getting into sleep, difficulty maintaining sleep or early morning awakening. This occurs around 30% of the population throughout the world and roughly 6 to 10% have true absolute insomnia or lack of sleep. There are innumerable causes for lack of sleep, starting from the various medical condition, psychiatric condition, drug abuse, various drugs, depression, anxiety, pain syndrome, rheumatological illnesses, and many other autoimmune or other conditions. So roughly it's said that at least you should have 3 days of lack of sleep or insomnia per week for minimum 1 month, then it would qualify insomnia, chronic insomnia. Because there are many acute conditions like some issues with you or with your family can temporarily take away your sleep. That's acute insomnia. That's due to some like fever or infection, hospital admission, some accidents. That would cause a short term or a 1 day, 2 day lack of sleep. That won't qualify the term insomnia. Insomnia should span over a period of weeks or months. All right. So what are the possible cause or the consequence of insomnia? If you don't get sleep, you would lose your productivity. Next day you would be drowsy, you would be daytime sleepy. This would affect your personal life, your social, your occupational and professional life, and all the achievement will be taken off from you because you would be most of the time you are inclined to sleep only. And there's an 8% chance of increased accidents. Can be in the motor vehicle accident as well as accident with the machineries or other aspects of various accidents. So it would disturb your quality of life. Various accidents are possible, and more than that, the person would be irritable, anxious, depressed, or will have various mood disorders. So it's of utmost important that you should have at least 6 to 8 hours of sleep every night. Okay, so supposing that you have lack of sleep, you should find out whether what is the real cause. So you should have a sleep diary with you. Sleep diary means you should write down when do you go for sleep and what is the time, what is the duration, when do you get up, and the pattern has to be written in over a period of days or weeks. Then you know that whether you have true lack of sleep or insomnia, or what are the other problem or symptom along with that. Because sometimes they can be associated various movement disorders in sleep, like restless leg syndrome. They would tend to thrash and kick the limbs because of pain or irritability. Or during sleep, the patient would move the limbs, called a periodic leg movements of sleep, or various myoclonus. Sometimes there can be seizure or epilepsy, or sometimes it can be sleep talking, sleep awakening, or somnambulism, sleepwalking. Many factors can get involved. Sometimes there can be obstructive sleep apnea with snoring. So it would disturb his spouse or somebody who lies next to him. So they should know that whether he has got snoring or other problem related to sleep or lack of sleep, or next time what's happening during the daytime, whether he would be sleepy, excessively sleepy, and there's something what we call it as a excessive daytime sleepiness. Some of them might be a form of narcolepsy, sudden lapsing into sleep for a few time like that, or with other manifestation like a sudden fall, laughter induced fall, or surprised or cry, or anxiety or falls, something like that, sort of cataplexy. That's a different disease called narcolepsy. So what are the various conditions which would precipitate insomnia? Okay, the various causes that you should be careful of. There's various pain syndromes, pain in the legs as well as the various joint pains, rheumatic illnesses, arthritis, neuropathy, depression, Parkinson's, stroke, and many conditions or chronic lung, liver, or kidney illnesses, which all would cause insomnia. Various vitamin deficiency, vitamin B12 deficiency, vitamin other vitamin deficiency, vitamin D deficiency can also would rise to insomnia. Should find out whether there is any endocrine dysfunction like hyperglycemia or hypoglycemia or neuropathy related to diabetes, or various endocrine abnormalities like hypothyroidism, hyperthyroidism, or problem with your adrenals as well as other pituitary or other organs. And of course there can be various people with Alzheimer's or various other neurodegenerative condition where all you can get a lack of sleep or insomnia. So as I've mentioned earlier, you should have a sleep diary, you should have sleep hygiene, you should go to bed every day at the same time, and should have a particular room for sleeping. You shouldn't sleep this room this day and next room on the other day. You should have a particular habit, and you shouldn't look at your iPhone or your mobile at least 3 hours before going to sleep. So you should avoid all the stimulating activities like playing chess or other intense games and all just before going to bed. Always take your food maybe at least 2 to 3 hours prior to going to bed. And don't do any exercise close to your sleep time. Always keep your exercise timing in the morning, and avoid excessive tea or coffee in the evening if you feel or if you happen to have insomnia. So tea, alcohol and smoking should avoid. And if you don't get sleep even after 5 to 10 minutes after going to bed, then of course you shouldn't turn around and get frustrated. Always get up, have a stroll in your room. You can read some light books or some boring books. You can listen to some music for some time. Then actually then go to bed. So always better to avoid tea and coffee immediately prior to going to sleep. And of course you should avoid or should remove all those habits which would prevent insomnia. So treat any medical illness, any psychiatric problem, any drug abuse, any drug or condition which would cause insomnia. You should consult a doctor and find out whether there are any factors which would promote insomnia. And secondly, as I mentioned, keep a sleep diary. You should have good sleep hygiene. And there are tests like polysomnography or multiple sleep latency test, and various other blood test levels for anemia, for diabetes, hypothyroidism, calcium abnormality, vitamin D, vitamin B12, like that. Sure, go to your physician or other doctor and find out any other premorbid conditions there, like especially obstructive sleep apnea, COPD, respiratory condition, many such conditions. Then of course there are various treatment options are there, and before having to start the medication, always do a relaxation in the morning, do some yoga, some exercise, prayers, and you should have a positive outlook in your life. Don't get frustrated more often. And if there are any social or psychiatric issues, you should consult your psychologist or psychiatrist or other counselor, and should try to remove all those potentially harmful factors which would prevent sleep. So there are many drugs are available, so I am not going to tell you all those things because there are the purview of your physician or a psychiatrist. And what I would like to tell you is that, so if there are insomnia or lack of sleep, you should find out why there is lack of sleep, and if there are any correctable causes, you should correct it, and do all these maneuvers or the methods like which would enhance good sleep. So let me conclude here by telling that you should have all should have a good at least 6 to 8 hours sleep every night. And with these few words, let me conclude here. Thank you very much.